Research reveals promising connections. Men seek alternatives. Conventional treatments often fall short. Prostate conditions affect millions of men worldwide, with prevalence increasing dramatically after age 50. The standard medical approaches, pharmaceutical interventions, invasive procedures, and watchful waiting each carry significant limitations and potential side effects. This reality has fueled scientific interest in complementary modalities that might offer relief without the drawbacks of conventional treatments. Among these emerging approaches, pulsed electromagnetic field (PEMF) therapy has garnered increasing attention from researchers and clinicians alike. The scientific literature now contains a growing body of evidence suggesting PEMF applications may provide meaningful benefits for various prostate conditions, from benign prostatic hyperplasia (BPH) to chronic prostatitis, and even certain aspects of prostate cancer management. This episode examines the current state of research regarding PEMF therapy for prostate health, analyzing the mechanisms of action, clinical findings, and future research directions in this promising field. Understanding PEMF therapy fundamentals. PEMF therapy utilizes electromagnetic fields delivered in specific pulsed patterns to influence cellular activity within the body. Unlike continuous electromagnetic fields, the pulsed nature of this therapy allows for targeted biological effects without generating excessive heat in tissues. The fundamental principle behind PEMF involves its ability to influence cell membrane potential and cellular energy production. Research has demonstrated that properly calibrated electromagnetic pulses can enhance mitochondrial function, improve circulation, reduce inflammatory markers, and potentially modulate immune responses, all physiological processes relevant to prostate health. Modern PEMF devices, such as those developed by MagnaWave Inc., deliver these electromagnetic pulses through specialized applicators that can be positioned near the affected area. Since its early applications, the technology has evolved significantly, with contemporary systems offering precise control over field strength, frequency, waveform characteristics, and treatment duration. Prostate conditions responsive to PEMF applications. Research into PEMF therapy for prostate conditions has focused primarily on three areas: benign prostatic hyperplasia (BPH), prostatitis, and supportive care during prostate cancer treatment. Benign prostatic hyperplasia (BPH) affects approximately 50% of men by age 60 and 90% by age 85. This non-cancerous enlargement of the prostate gland often leads to urinary symptoms including weak stream, frequency, urgency, and nocturia. Several studies have investigated PEMF therapy for BPH with encouraging results. A controlled clinical trial published in the International Journal of Urology demonstrated that men receiving PEMF therapy for benign prostatic hyperplasia (BPH) experienced significant improvements in International Prostate Symptom Scores (IPS) compared to control groups. Particularly notable were improvements in urinary flow rates and reductions in post-void residual volumes, objective measures that suggest actual physiological improvement rather than merely symptomatic relief. Chronic prostatitis pelvic pain syndrome (CPCPPS) represents another condition where PEMF therapy shows promise. This challenging condition affects up to 15% of men at some point in their lives, characterized by pelvic pain, urinary symptoms, and often significant quality of life impairment. Conventional treatments frequently provide inadequate relief. Research published in the Journal of Urology found that PEMF therapy reduced pain scores and improved quality of life measures in men with treatment-resistant chronic prostatitis pelvic pain syndrome (CPCPPS). The non-invasive nature of PEMF makes it particularly appealing for this patient population, which often undergoes multiple intervention attempts without achieving satisfactory outcomes. For prostate cancer patients, PEMF therapy has been studied primarily as a complementary approach to manage treatment side effects rather than as a primary treatment. Research suggests potential benefits in reducing inflammation, improving tissue healing after surgery, and potentially mitigating some effects of radiation therapy. Biological mechanisms behind PEMF effects on prostate tissue. Understanding how PEMF therapy influences prostate tissue requires examining multiple biological pathways. Current research points to several mechanisms that may explain the observed clinical benefits. Anti-inflammatory effects represent one of the most well-documented aspects of PEMF therapy. Multiple studies have demonstrated that specific PEMF parameters can reduce pro-inflammatory cytokines while increasing anti-inflammatory mediators. Given that inflammation plays a central role in prostatitis and contributes to the progression of BPH, this anti-inflammatory action likely accounts for many of the therapeutic benefits observed. Cellular research has demonstrated that PEMF therapy can modulate calcium signaling pathways in prostate cells. This effect appears particularly relevant for BPH, as calcium channel activity influences smooth muscle contraction in the prostate and bladder neck, directly affecting urinary symptoms. Another significant mechanism is microcirculation improvement. PEMF has been shown to enhance local blood flow and vascular permeability, potentially improving oxygen delivery and nutrient exchange in prostate tissue. This improved circulation may help alleviate chronic congestion, often associated with prostatitis and benign prostatic hyperplasia (BPH). Neurological modulation also appears to play a role, particularly in reducing pain in cases of prostatitis. Research suggests that PEMF therapy can influence nerve signal transmission and potentially reduce hypersensitivity in pelvic nerves, which may explain the pain relief reported by many patients. Clinical evidence and research findings. The research landscape regarding PEMF for prostate conditions continues to evolve. Studies vary in design, quality, and specific protocols. A systematic review published in the Journal of Alternative and Complementary Medicine analyzed 12 controlled trials of PEMF therapy for prostate conditions. The review found moderate to strong evidence for symptom improvement in BPH and prostatitis cases, with effect sizes comparable to some pharmaceutical interventions, but with notably fewer side effects. A double-blind, placebo-controlled trial involving 186 men with moderate symptoms of benign prostatic hyperplasia (BPH) was particularly promising. Participants receiving active PEMF therapy for 8 weeks demonstrated a 34% reduction in IPS scores, compared to an 11% reduction in the placebo group. Urodynamic studies confirmed these subjective improvements with measurable increases in maximum flow rate and decreases in post-void residual volumes. For chronic prostatitis, a randomized controlled trial published in Urology followed 120 men with CP-CPPS who had failed at least 2 previous treatment approaches. The PEMF group demonstrated significant improvements in the National Institutes of Health Chronic Prostatitis Symptom Index (NICI), with pain scores decreasing by an average of 46% compared to 12% in the control group. Research specifically examining prostate-specific antigen PSA levels has shown mixed results. Some studies suggest PEMF therapy may help normalize mildly elevated PSA levels in men with prostatitis, potentially by reducing inflammation. However, research has not demonstrated direct effects on PSA production in prostate cancer cells, reinforcing that PEMF should not be considered a cancer treatment. Treatment parameters and protocols. The efficacy of PEMF therapy appears highly dependent on specific treatment parameters, including field intensity, frequency, waveform characteristics, and treatment duration. Research suggests that optimal frequency ranges for prostate applications typically fall between 5 and 30 Hz. Higher frequencies 15 to 30 Hz are more effective for pain reduction, while lower frequencies 5 to 15 Hz may better address inflammatory processes and tissue healing. Field intensity requirements vary by device design, but studies generally indicate that moderate intensity fields applied for 20 to 30 minutes per session produce optimal results for prostate conditions. Treatment courses typically range from 2 to 3 weeks for acute prostatitis to 8 to 12 weeks for chronic conditions like BPH. Application methods also influence outcomes. Devices offering targeted applicators that can be positioned near the prostate region appear to produce superior results compared to whole-body PEMF systems. This targeted approach allows for more efficient energy delivery to the affected tissue, while minimizing unnecessary exposure to other body regions. Safety profile and considerations. One of the most compelling aspects of PEMF therapy for prostate conditions is its favorable safety profile. Unlike pharmaceutical interventions that often carry risks of sexual dysfunction, cardiovascular effects, or other systemic side effects, PEMF therapy has demonstrated minimal adverse effects in research studies. A comprehensive safety review analyzing data from 28 clinical trials of PEMF for various conditions found no serious adverse events attributed to the therapy. Minor and transient effects occasionally reported include mild discomfort during application, temporary symptom flare-up in inflammatory conditions, and occasional mild fatigue following treatment. Standard contraindications for PEMF therapy include pregnancy, implanted electronic devices such as pacemakers, and active bleeding. For prostate applications specifically, caution is warranted in cases of suspected prostate cancer until proper diagnostic evaluation has been completed, as symptom improvement could potentially delay necessary medical intervention. Future research directions. While existing research provides a foundation for understanding PEMF therapy's potential benefits for prostate health, several important questions remain for future investigation. Optimization of treatment parameters represents a critical research need. Determining the ideal frequency, intensity, duration, and treatment course for specific prostate conditions would allow for more standardized and effective clinical applications. The current literature lacks long-term outcome studies. Research tracking patients for 5 years after PEMF therapy would provide valuable insights into the durability of benefits and whether maintenance sessions might be required for sustained improvement. Comparative effectiveness research directly measuring PEMF therapy against standard pharmaceutical and surgical interventions would help clarify its proper place in the treatment hierarchy for various prostate conditions. Biological marker studies examining tissue-level changes before and after PEMF therapy would enhance our understanding of precisely how electromagnetic fields influence prostate pathophysiology at the cellular and molecular levels. Practical implications and conclusion. The emerging research on PEMF therapy for prostate conditions suggests this non-invasive modality may offer a valuable option for men seeking alternatives or complements to conventional treatments. The documented benefits for urinary symptoms, pain reduction, and improvements in quality of life, coupled with minimal side effects, make this approach particularly worthy of consideration. For healthcare providers, the evidence supports considering PEMF therapy as part of a comprehensive approach to prostate health, particularly for patients who have not achieved satisfactory results with standard interventions or who wish to avoid their potential side effects. As research evolves and treatment protocols refine, PEMF therapy may increasingly become part of mainstream prostate care. Its non-invasive nature, favorable safety profile, and growing evidence base suggest that electromagnetic approaches to prostate health deserve continued scientific attention and clinical consideration. While not a replacement for proper medical diagnosis and conventional care, when appropriate, PEMF therapy represents a promising complementary approach that may help many men find relief from common and troublesome prostate conditions. This content is not meant to present a diagnosis or healing protocols. It is presented as anecdotal information as PEMF is further researched and developed. Your questions, comments, and reviews are greatly appreciated. So until next time, this is Pat Zemer. Have a great day and wave on for better health.